Great, thank you very much, Gemma. Well, no doubt we'll have some more questions and opportunity for discussion towards the end of the session. But for now, thank you very much. And we will invite our next presenter, Kate Sutton, to join the conversation. So Kate is a leading contributor in the humanitarian sector in Australia and the region. She has spent over 20 years in operational and leadership roles in international organisations, including 8 years of field-based roles in humanitarian contexts. Since 2012, Kate has been based in Melbourne as the founding director of the Humanitarian Advisory Group. She's had several evaluations on humanitarian response operations, including evaluation of Australia's humanitarian assistance in a variety of contexts, as well as reviews such as the Transforming Surge project evaluation for the START network. Her research focuses on diversity and inclusion in the sector, as well as protection and localisation. Kate was selected as one of Australia's top 100 women of influence in 2015 and was awarded the Humanitarian Overseas Service Medal by the Australian Government in 2016. Kate has a Master of Human Rights Law and a Master of International Development. And Kate is going to be speaking to us today about how diverse leadership has shaped responses to COVID-19 within the Red Cross and Red Crescent movement. Over to you, Kate.
Thank you very much, Mel. And thank you also, Gemma. That was really fascinating to listen to your presentation, and excited that actually it picks up on some of the themes that I will also be talking to, which I think is really helpful to build on the diversity and inclusion questions, but also that critical point that you made around how decisions are made. And this piece of research that we undertook as a research collaboration between Humanitarian Advisory Group, Glow Red, which is a network within the movement, the IFRC and ICRC, was actually looking exactly at that. How are decisions made, or how were decisions made in the responses to COVID-19, and understanding how diverse voices at the table influenced that. This piece of research is part of our Humanitarian Horizons research program, which is a DFAT funded program. And we have a broader piece of work which is looking at diversity and inclusion. And an area that I'm really sort of passionate about is how we develop a clearer evidence base for the importance of diversity and inclusion to really drive change in the sector. So within this program, we were looking at two very specific research questions. One was, how have diverse humanitarian leaders prepared for and responded to COVID? The second question was, is the response influenced by the diversity and individual characteristics of the leadership? And if so, how? Now, there's a really fundamental assumption that sits under this. We made an assumption that having different views and perspectives at the table was always going to be a good thing. The other point around this that's really important, I think, is that we were not trying to make judgments about what was right or wrong. So we weren't trying to say that one view or perspective was right and another one was wrong. What we were trying to say was that it was important to make sure that when critical decisions were being made during the COVID response, that there were different views and perspectives at the table. And we believe that having those different views and perspectives will inherently lead to better decision making. This assumption is really well grounded in other sectors. I think I'd point particularly to the private sector. They have so much data around what difference it makes to have different people at the table. So they know, for example, things like when you have a more diverse leadership team, they increase innovation in the products they develop by about 20%. They also know that when you have a more diverse and inclusive leadership team, you reduce risk by about 30%. And I think this has sort of fascinating implications when we're thinking about things like the prevention of sexual exploitation and abuse. How are we ensuring that we have different voices to help us solve some of these really challenging issues in our sector? So how we went about this, it was a research project which took place over about 9 months. We did a number of key informant interviews with leaders within the Red Cross in a number of different country contexts. We undertook a survey and had over 350 responses. It was primarily a statistical analysis that we were doing of that survey data. We were applying a chi-square analysis. We were trying to understand whether or not there was a statistically significant difference in the way that decisions were made by different groups of people. Now, just another really important thing I think to highlight here is we had to categorize people on areas like gender, their identification with a racial or ethnic minority, their nationality, but by no way do we want to suggest that intersectionality is not important. Obviously, when people make decisions or contribute at the table, they bring their whole selves. They don't just bring themselves as a woman or as somebody from a particular country context. They bring everything that they are. So we recognize that intersectionality is important. Notwithstanding, there were statistically significant differences between groups of people and the decisions they made. So we looked at this through the framework of decision-making building blocks. We looked at sort of these key areas of decision-making to understand the ways that individual characteristics influenced. The areas we looked at were outcomes, so that idea of why are we doing it? Evidence, how people gathered evidence in the midst of the COVID response and what sort of data people collected. Options, so what possibilities people put on the table. We talked about people, that's a lot of the HR issues. Who were they recruiting? How were they including the voices of different people? Interestingly, picking up on some of Gemma's points there, we went to some of those questions. We looked at process, what steps people took, how they implemented, and also the extent to which people made decisions around risk. Just before I jump into some of the key findings which were coming out, I think it's really important to note that leaders themselves believe that their characteristics shape how they approach leadership. And this is, you know, I guess it's intuitive, but in many ways, people talked about the fact that their values really drive who they are. There was lots of interviews where people spoke about their gender and how that influenced decisions that they made. As well as people talking a lot about their experiences, so either their professional experiences or their experiences when they grew up. And this quote, which came from one of the Red Cross leaders, whether you like it or not, your personal experience does influence how you behave as leaders and what you prioritize. On that journey, there is experience. So I think what we need to understand as humanitarian practitioners is how we draw on that diversity of experience rather than, I think as Gemma was alluding to, just having quite a sort of homogenous leadership type that are currently represented in the sector. So I'm going to jump into some of the findings. I will touch just on a few aspects of them, and then hopefully if people have questions, I'm happy to outline a bit further. So in terms of outcomes, one of the things that we looked into was the fact that people had to balance in the response pre-existing humanitarian needs and then new emerging humanitarian needs that were presented within the COVID context. And what we found was that actually different groups were able to balance in different ways. We categorized leaders from different country contexts, and we had one category of leaders which were from countries that were historically underrepresented in leadership. So non-Western, if you like, but I'm happy to go into which sort of context that included. And they were far more likely to prioritize both COVID humanitarian needs, but also those pre-existing humanitarian needs. It was also interesting that those that had more professional experience in the sector were also more likely to balance those needs between the pre-existing and new needs that came along. The second building block that we looked at was evidence. What we found here was that diversity of gender and professional experience actually led leaders to both seek and use evidence in very different ways. There were a lot of people who spoke to the importance of evidence. A number of leaders within the Red Cross, for example, with public health background, this one particular person talked about their guiding principle for leadership being evidence. And this was particularly driven by their background in public health. And what was interesting was that women were actually far more statistically significantly more likely to use internal evidence gathering mechanisms such as staff surveys. And they were also more likely to have undertaken assessments to inform decision making. So for example, they did assessments on the responses to the financial impact. Men, on the other hand, were more likely to gather evidence externally, and this was largely through conversations with other organisations and contacts. So options was really looking at what are the possibilities, what are the different ways that we could go, and the extent to which that conversation happened over the decision-making leadership table. And what we found was that diversity of professional experience was really the key here in terms of bringing different ideas to the table. So leaders who either had more time outside the sector or who had taken on a greater variety of roles within the Red Cross movement brought a vast variety of different ideas to inform the discussion. And I guess in some ways this is really intuitive, but what it talks to is that idea that we really do need people who have worked in other areas at the table or who have different experiences within our sector to be able to help just bring different ideas and different options, particularly in a situation like COVID, where you really need some creative solutions in order to be able to adapt. The couple of examples here are from people who'd actually worked in the Ebola response and were able to bring that experience to the table when they were then talking about the COVID response. The next building block we looked at was people. And this, as I said, went to like the HR issues, but also how leaders engaged their staff. So the key finding here was that diversity of gender and representation of leaders that identify with an ethnic or racial minority supported diverse communication modalities. This was one of the most interesting findings for me through the entire research, was that there was a statistically significant finding around leaders who identified with an ethnic or racial minority, and they were far more likely to have personally implemented an anonymous feedback option for staff. And this really goes to their depth of understanding of the necessity of it, the fact that many of those leaders may in their own journey have experienced racism or discrimination. And this quote, I think, really sort of explains it all. If you're saying there is no value for safe space, you've probably not gone through that, referring to racism and discrimination. So try and talk to some of the colleagues who have been through that. We do have some way to go on those issues. And this really goes to, you know, when we were having a lot of these discussions, Red Cross members and leaders were really open to the fact that not only within the Red Cross, but as a sector, there is a really long way to go to ensure that those safe spaces are being created, as Gemma referred to as well. Men was significantly more focused on personalised assistance to staff and with a particular focus on physical well-being. And women were much more likely to have intentional conversations with staff members around child protection issues and also to provide resources and support in relation to child protection. So thinking about process, which was really what were the steps that people put in place, how did they implement the response and what needed to happen in terms of COVID? Diversity of age and tenure really was the key influencing factors here in terms of different approaches. So leaders who were aged over 50 were much more likely to undertake key steps to guide the response trajectory than leaders maybe with less experience. And again, I feel like this is quite intuitive in terms of having had more experience of how to put these processes in place, but helpful to have some of that statistical basis for this in terms of how you need to have those different voices at the table. And leaders with less than 5 years experience outside the sector, and therefore with a potentially better understanding of the sector and how we operate and how processes are put in place within our sector, we're more likely to prioritise things like financial adjustment and repurposing. And also we're more likely to have done an early strategy on the response to COVID. The final building block that I wanted to share was in relation to risk. This is really the decision-making around all the things that could potentially have gone wrong and how leaders chose to manage that. So across all the areas of risk, whether we're talking about compliance, PSEA, child protection, financial risk, we actually didn't find that one group of leaders was more likely to have implemented additional risk processes. But what we did find is that leaders who'd had more experience outside the sector and leaders from countries more traditionally represented in leadership, as well as those that were aged over 50, were much more likely to undertake a financial risk assessment. And so what does it all mean? I think one of the really exciting aspects for me around this research is that it's beginning to take conversations away from an emotional space around needing diversity and inclusion into an evidence-based space. By providing statistically significant data, we're able to say that we do know that there are different perspectives that are brought by different groups of people. And that by not having those different people at the table, you are very likely to miss different ideas. You're very likely to be less able to innovate and really think about all the different things that may be required. And I go back again to that idea around confidential feedback mechanisms. That voice at the table around raising the importance of an issue like that is something that we do not want to miss because we don't have the right people there telling us what needs to happen. The other point is emphasizing the importance of inclusion. This came through not so much in the survey work, but in the interviews that we did, where people did talk about experiences whereby, yes, they may have been at the table, but did they actually feel consistently safe to be able to raise a different opinion or a different idea? And that's something that I think we have a really long way to go with in our sector, and really welcome people's reflections on how we move that forward. But I will close it there and look forward to your questions and comments. Thanks, Mel.